IMRT, or intensity modulated radiation therapy, is an advanced radiation technique that allows more precise targeting of mesothelioma tumors while reducing damage to surrounding healthy tissues. While radiation has a limited role in mesothelioma treatment, IMRT represents the most sophisticated approach when radiation is used. Today, I want to explain what IMRT is, how it differs from normal radiation, and why it might be used for mesothelioma, and what evidence exists for its effectiveness, as well as what side effects to expect. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this isn't medical advice, but understanding IMRT helps you evaluate whether this approach might benefit your situation. So let's start with what IMRT actually is and how it differs from conventional radiation. Conventional radiation uses uniform beams of radiation directed at the tumor from a few angles. The intensity is the same throughout, like shining a flashlight with consistent brightness. The challenge with conventional radiation for mesothelioma is that this particular kind of tumor wraps around organs in complex shapes. Delivering adequate radiation to the whole tumor while protecting organs like the heart, lungs, esophagus, and spinal cord is nearly impossible when you're using uniform beams. IMRT uses computer-controlled radiation beams that can vary in intensity across the treatment field. Think of it like having a flashlight where you can dim or brighten different parts of the beam. The radiation machine rotates around you, delivering beams from many angles, sometimes dozens of angles, and the intensity within each beam is modulated to conform precisely to the tumor's shape. This allows radiation oncologists to sculpt the radiation dose. High dose goes to the tumor, medium to areas at risk for microscopic disease, and minimal dose to protect normal structures. How's IMRT planned? It's complex and time-consuming. First, you undergo a CT simulation scan for exact positioning. It creates a 3D map of your anatomy, and the radiation oncologist then uses that to figure out what areas of the tumor need to be treated and what areas need to be protected. A medical physicist uses sophisticated computer software to design the treatment plan. The software calculates how to modulate beam intensities from multiple angles to deliver the prescribed dose to the tumor while minimizing the dose to normal tissues. This optimization process can take hours or days of computer time. The plan is reviewed and refined until the best possible balance is achieved between tumor coverage and normal tissue protection. The entire planning process typically takes 1 to 2 weeks. Now, before I go on, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for those who need this information to find us. And if you have questions or a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end because I'll give you valuable information on where to find resources that will make a real difference for you. So when might IMRT be used for mesothelioma? The main scenarios include post-operative radiation after pleurectomy decortication. Some centers give IMRT to the entire hemithorax, which means the whole affected side of the chest, after lung-sparing surgery to target microscopic residual disease. Palliative radiation to painful areas uses IMRT too. It delivers higher doses to the painful tumor while protecting surrounding tissues. Prophylactic radiation to procedure tracts can sometimes use IMRT, though simpler techniques often suffice. Treating isolated recurrences in specific locations can use IMRT for precise targeting. Now, what's the evidence for IMRT in mesothelioma? It's limited, and it comes mainly from single institution experiences rather than large randomized trials. For post-operative radiation after pleurectomy decortication surgery, some centers report using IMRT to the entire hemithorax, and early reports suggest this was feasible without being too toxic, unlike older techniques or the same type of approach with conventional radiation caused damage. Some studies have shown that it can keep the disease from recurring in a treated area, about 50 to 70% of that. However, the benefit for overall survival isn't clear. There haven't been any randomized trials to show that after pleurectomy decortication, it improves how long patients live compared to surgery and chemotherapy without radiation. The challenge is that even with IMRT, treating the entire hemithorax to adequate doses while keeping the lung, heart, and esophagus protected is really hard. The treated area is huge, and it contains many critical structures. For palliative radiation to specific painful areas, IMRT allows delivery of higher doses to the painful tumor with less collateral damage, and this can provide good pain relief. 60 to 80% of patients report a significant pain reduction. What does IMRT treatment involve practically? So after the planning process, you begin daily treatments. IMRT is given Monday through Friday, typically for 3 to 6 weeks, depending on the dose and the purpose. Each daily session takes about 15 to 30 minutes, and most of that is setup time, positioning you exactly as planned. The actual radiation delivery is just a few minutes. You lie still on the treatment table, and the radiation machine rotates around you, stopping at various angles to deliver beams. You don't feel anything during this process. Custom immobilization devices that are molds, masks, or positioning aids are used to ensure that you're positioned identically each day, and small permanent tattoos are also used to mark alignment positions. So what are the side effects specific to IMRT for mesothelioma? Despite precise targeting, side effects still occur because of the large treatment volumes and proximity to critical organs. Fatigue is universal and worsens through treatment and continues for weeks. Esophagitis, which is inflammation of the esophagus, can occur if the esophagus is in the radiation field, and this causes painful swallowing and might require a soft diet or pain medications. It typically peaks 2 to 3 weeks after radiation ends and then improves. Pneumonitis, which is radiation lung inflammation, can occur even with IMRT, though the risk is lower than with other techniques. It develops 1 to 3 months after the radiation and causes cough and shortness of breath. Mild cases resolve on their own. Moderate to severe cases require steroids. Skin reactions in the treatment area are common: redness, dryness, itching. Cardiac effects can occur if the heart receives a significant radiation dose, but IMRT does minimize this. Long-term fibrosis, which is scarring of the lung, chest wall, or other tissues in the radiation field, develops over months to years, and it can cause permanent changes in lung function and chest wall flexibility. How does IMRT compare to proton therapy? Proton's another advanced radiation technique that uses protons instead of X-rays. Protons deposit most energy at a specific depth, then stop, while X-rays continue through the body. Theoretically, it could deliver radiation to mesothelioma with even less damage to underlying lung and other structures, but proton therapy for mesothelioma is still largely investigational, available at only a few centers, and it's extremely expensive. Most mesothelioma patients receiving radiation get IMRT, not protein therapy. What questions should you ask if IMRT is recommended? Start with, why are you recommending radiation for my case? Whether it's post-operative treatment, palliation, or another reason. What dose? How many weeks of treatment? What are the goals? Are we trying to prevent recurrence, relieve pain, or is there something else? What are the expected side effects and how severe will they be? What are the alternatives and how does this fit in with chemotherapy or other treatments? Ask what the evidence is that it's going to help you. To review, IMRT is advanced radiation therapy using computer-controlled beams that vary in intensity to precisely target mesothelioma while protecting normal tissues. It uses sophisticated planning with a dose sculpted to conform to complex tumor shapes. It might be used post-operatively after pleurectomy decortication. It could be used for palliative pain relief or for isolated recurrences. The evidence for a survival benefit is limited, but there aren't any trials that prove it one way or another. Treatment is given daily, Monday to Friday, for 3 to 6 weeks, and side effects include fatigue, esophagitis, pneumonitis risk 1 to 3 months later, and long-term lung fibrosis. The bottom line is IMRT is more precise than conventional radiation, but it's still challenging given the large treatment volumes. You can visit mesothelioma.net for more information about radiation therapy and mesothelioma treatment, or call 800-692-8608 or use the live chat feature on our website to work with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.